seeing significant increases of COVID activity in India, US, and South Africa. Sabi nga ni Dr. David in one of the fora that he attended. And there's been a warning na we might see a surge in May or June this year. I'm wondering lang po, is this a concern that we have or is this a certainty? In other words, is this inevitable na pag meron ng subvariants na kumakalat sa ibang bansa, sooner or later, are we going to get it and are we going to get it big? Just to lay down expectations po. Who would want to start? Doc, kayo po. Doc Rontgene.
Okay, yes. So based on our experience before, with other variants of concern, even with the strict border control, and even in those days we really have strict testing. It was inevitable, and I would say really it will be inevitable. Now the scenario now is that we're better compared before. Why? A lot of us are vaccinated.
Yeah.
But what's the concern now is the waning immunity. Yeah. Now the prediction of March, April, May, June is based on most of those population that were vaccinated or received the primary vaccine series November, December. There is really significant waning of that immunity, and that will be an important factor, increase in the cases and transmission.
Sir, Doc, before I move to Professor, when you say inevitable po makapasok dito. But I'm wondering po kung if it's inevitable, is it safe to say it's inevitable that we will have a surge, or new surge this year?
Well, quite difficult to say if we'll have a. There is high certainty that we may have that possible surge because of the explanation I mentioned, Ed.
Okay, not good news. Dr. David.
Well, mathematically, yung projection ng OCTA, you've been fairly accurate in your projections. Ano yung nakikita nyo sa ngayon? Because you have noted a slight increase, actually a worrisome increase in cases. Ano ba yung nakikita ninyo ngayon exactly?
Well, Ed and Ami, sa ganitong situation, usually nga bine-benchmark natin yung nangyayari sa Philippines with what happens in some countries na medyo similar yung characteristics. In this case, yung mga binabantayan namin, India, Indonesia, and South Africa among a few. Kasi let's say, kunyari, nag-surge sa China, it doesn't mean, or sa South Korea, it doesn't mean we'll have a similar surge kasi sila, they're just having the Omicron surge sa ngayon. So hindi naman siya comparable. Pero pag nagkakaroon ng increase ngayon sa South Africa and may na-detect na bagong subvariant dun, the BA4 and BA5. So sa India, meron din bagong subvariant, yung Omicron BA 2.12. It's a concern kasi tapos na sila sa Omicron and this is a subvariant of Omicron pero somewhat similar, I mean generally similar. Tapos nagkakaroon ng increase in cases. And also yung timeline nila, the increase is happening about 3 to 4 months after their initial surge. So ibig sabihin, may factor talaga dito yung waning immunity na sabi ni Dr. Solante. So the waning immunity is a factor, the new subvariants is a factor, and of course we also have to deal with yung complacency sa health protocols. Pero given that these are happening now in South Africa, hindi ko masasabi siguro 100% certain that it will happen. It could be preventable, pero it seems very likely at this time that we'll have some kind of surge. Tinitingnan ko ngayon sa South Africa. The increase is not as bad as nung Omicron surge nila last year in terms of yung reproduction number. Right now, nag-increase na to 2 yung reproduction number nila. So if we have a similar type of surge dito sa Philippines, if we have a reproduction number increase to 2, it won't be as bad as the Omicron wave. Baka mas mababa siya. It could be similar to the Delta wave or the Alpha Beta wave. And that's because we have a significant number of vaccinations, tulad nga sabi ni Dr. Solante. But maybe if we could add to the vaccinations pa and to the boosters, we might be able to control the number of cases even further.